or hot.
Why do you want to decide whether a patient is chilly or hot?
To select the remedy.
To
To
differentiate the remedy.
differentiate the remedy.
Okay. So, firstly, using chilly or hot, using the thermals to eliminate remedies is not what I usually practice. If the thermals are very intense, if they are very spontaneous in the narration of the patient, then they are important for me, and then I will use them for differentiating or eliminating remedies. If they are not intense or if they are not spontaneous, then we can ask in the end. But for that, the first question is obviously uh, which season do you tolerate better? Which season do you prefer? These questions should be a good starting point. And if you get something peculiar in that narration, then to pick up on that is a better way. For example, if the patient says, I'm chilly, I don't tolerate winter well, this is not enough. Then people go for measures like asking, are you using hot water or cold water for bathing? How many coverings do you require? Instead of going into those questions directly, it is better to just say, describe what you mean by I don't tolerate winter. And if the patient himself or herself says, I just can't tolerate, even as the winter is starting, even people are not even feeling chilly or cold, I'm the first one to wear sweaters, I'm the first one to need 2 3 coverings, then in this case probably your thermals are going to be important if it is coming in the end. Generally what happens is, the moment you start asking about whatever, about joint complaints, let's say, and the patient says my joint complaints are aggravated in winter, there itself you can start talking about the winter and ask, what else happens in winter? In general, do you not tolerate winter better? And then see what are the symptoms that come up. See how the patient is expressing this, and it will come out better. So, thermals are not important in each and every case, like we have been taught. They are important if they are intense and spontaneous.